folks. Welcome to another program of Your Mind Matters. I'm Dr. Mike Ellison, joined by our producer, Mr. Mo Raza, hypnotherapy and dental phobia in particular. Dental phobia keeps people from getting dental care. And so it's a real issue in dentistry because people will not have their teeth cleaned for years. They will not get cavities seen to when they could be easily treated. So when you talk to dentists, they know that dental phobia is real, and they are trying to work with their patients in the best way that they know how to make sure that doesn't happen. And so they use something called conscious sedation, where they use medications that do not render the person unconscious, nor do they need to be intubated with a breathing tube, but they're conscious, but they're not really altogether kind of there, and they kind of arouse the person when the procedure is over. The meds are very quick acting and they're very short acting. And so that is the benefit is that they kind of wake you up, so to speak, at the end of the procedure and say, well, it's time to go home.
You can drive home that day.
Yeah, and you can kind of wake up and go, gosh, I didn't feel anything. And they go, yeah, that's what you're supposed to say. And you look fine now, so if you're ready to go, then you're ready to go. And you're ready to go.
And all this time I'm thinking it's the bill that we're all phobic about.
There's so much more to it than the money.
That is interesting.
Isn't it though?
Yes.
I love these capacities of the mind because to me they're just endlessly fascinating,
Right, because I feel like we haven't tapped into what our mind and body can do.
Yeah. Oh yeah. And I love the extremes that normal people go to that we need to talk about sometimes. Like when I was jumping out of airplanes, I was young, and skydiving was really a very exciting thing. And it was at a time when a lot of the Navy SEALs were coming out of the Vietnam War. And this is the first that we'd ever really heard of the SEALs. They had been formed in the mid-'60s, and so they were doing some stuff during the Vietnam War that we didn't hear about until after the war, right? And so I would skydive with guys that said they were Navy SEALs, and I would be like, well, what is that, Now everybody knows about the SEALs.
The cream of the crop.
Yeah. And so, but one of the interesting things that I find about mind-body connection with people like the SEALs is that during that famous Hell Week where they're under continual stress and pressure 4 or 5 days at a time, and they don't sleep, what they teach the SEALs even at that early point, you're going to be hallucinating, you've got to fight through the hallucination and still do the mission. Because after 3 or 4 nights without sleeping under constant physical stress, we hallucinate. And they teach them, hey, that's going to happen. That's just normal. You just got to find a way to get through it. It's like learning how to deal with your own bad drug trip in your head. So it's really amazing that they can teach people how to compensate and perform the mission even though they're in these very challenging environments.
So I got a silly question. So saying that, they're trained to overcome their hallucination. Like you were saying, the bad drug trip, now you have to get over it. Do Navy SEALs tend to have minimal mental illness and PTSD? Do they control it better, or they know how to handle it better? Not control it, but handle it better when they're going through their trauma?
That's a really good question and an intriguing one. The evidence that I'm aware of shows that like all military who have been exposed to combat, that PTSD occurrence in special forces operators is about the same, if not a little bit more, than the normal or routine combat soldier experiences.
Oh.
So probably 25% of post combat individuals show signs and diagnose positive for PTSD. Now, whether they stay that way as time goes on, or if they get treatment, does that change? Or do they repress those symptoms and just not act out that kind of mind control, and they suffer inside? Of course, the ones that I've seen are the ones who've gotten to the point where they think, I need some help, I need some coaching on this, I need to contact a therapist. And so while I've not been deployed to a combat area to treat people immediately, we see PTSD in first responder populations, and especially during COVID, we had a volunteer group of EMDR therapists who worked with the local hospital system and used EMDR therapy, working with physicians and nurses and others in the healthcare field who were having PTSD symptoms from treating COVID.
Can't even imagine.
So, and it's like special forces operators that yes, they're highly trained, and yes, they have very strong minds, but the human mind was really never designed to address some trauma. And so, although it's true that if you expose a whole group of people to a traumatic situation, not all of them develop PTSD.
Very true. Yeah.
You know,
we all take it in differently.
That's right. We have a different perception. Each of us perceives things differently. And so some people will be catastrophically disabled by what they've seen and experienced. And others will go, wow, that was terrible, but I'm okay, and shrug it off. Sometime we'll talk about the 2 Delta crashes here at the DFW airport.
Yes, that'd be interesting.
And the work that I was involved with in working with those crash survivors and their families. That's another show, but we'll do that. We'll talk about that.
Well, thank you, Dr. Ellison, for your time. I really appreciate that. That gives you a better understanding of what the mind can really do.
Thank you, Mo. It's always a pleasure.
Stay tuned for our next episode.